Hi, welcome to Deep Sea Foundation YouTube video. I'm Terry QT, Director and Founder of Deep Sea Foundation. I have the honor and privilege of sitting with Dr. Kocak and Tiwari from Midwest Breast in Columbus, Ohio today. And we're going to talk about the unfavorable
implant reconstruction.
Thank you.
And how to manage it.
Yes, thank you very much. We practiced this, but it just didn't come out right. And I'm going to let these guys talk about it. We haven't had this discussion on the channel yet. And so I'm going to let these guys take over and tell you all about it. Thank you guys both so much for joining us today.
Terry, thank you for coming to Columbus, Ohio. Go Bucks!
Yeah.
I had a Buckeye last night, and it was pretty delicious, dipped in chocolate. I will have to say.
Fantastic.
Yeah.
Yeah. I'll start.
Thank you.
I'll start by just saying what is an unfavorable implant reconstruction, because I think a lot of people sometimes don't really know the full scope of what an unfavorable implant reconstruction is. It can be something as obvious as an implant that outright fails, something that gets infected, maybe after radiation it gets capsular contracture and the implant is removed. So if an implant's been removed, we consider it to have been unfavorable in the form that it failed.
Mm-hmm.
There are other ways where it's unfavorable. Sometimes an implant can be painful, it can be uncomfortable, it can be it can have an animation deformity if it's under the muscle, it can jump when the arm moves. So all these things, or it can just be asymmetrical. All of these things constitute potentially an unfavorable implant reconstruction. There's things we can do to sort of remedy that situation.
A lot of patients we find when you get diagnosed with breast cancer, there's so much information coming at you. And a lot of patients feel like they didn't quite understand what they were being told when they decided to move forward with an implant reconstruction. But after the fact, what we see a lot in our practice, about a third of our practice is managing the unfavorable breast reconstruction with implants, are people with pain, like Dr. Kocak mentioned. Oftentimes the pain is kind of in the back at your scapula. A lot of these implants are beneath the muscle, beneath the pec muscle, which is a big muscle on your chest. And that connects to what's called the serratus muscle, and it wraps around towards your back. So a lot of patients have pain in the back, very common with some muscular implants. It's worse, I think, with radiation.
Yeah, radiation certainly leads to more of these types of issues. It tightens the muscle. So if it's under the muscle, you'll end up with more pain. It also can cause a higher rate of capsular contracture, which will ultimately lead to potential failure. But really, when these things occur, how do we actually manage them? And so typically, I'd say in most cases when it's an option, the goal is to get the implant out, to get the capsule out, to be able to get that muscle off of the skin and the reconstruction, get it back on the chest wall, and be able to put a reconstruction now in front of the muscle to be able to create the reconstruction. Sometimes it can be done with an implant, but a lot of times, especially if there's been radiation, we'll usually try to find some natural tissue options. And obviously the deep flap is one of the more common ones.
Mm-hmm. And I think it's important to emphasize, the breast was never meant to be behind the muscle, obviously. It's meant to be on top of the muscle.
Yes.
And one thing that's really unfavorable about an implant is when it's underneath the muscle, it causes all types of unusual discomforts, animation deformity. That's when you contract your muscle and the implant sort of moves in an unusual kind of atypical way.
Sometimes called muscle flex deformity.
Muscle flex deformity. And so these are all things that we're trying to address. I've had patients who've had pain in their neck because just like the pec muscle inserts to the serratus, it's also continuous with the fascia and the muscles in your neck. So I've had patients who have actual neck pain because of their radiated implant. And sometimes it's not even the fact that it's radiated, it's just having a large implant underneath the muscle. So part of this is putting the muscle back to its normal position.
I think it's also important to, as we talk about how we remedy this or revise it, one of the things we routinely do, we like to not only take the implant out, not only get the muscle back to the chest wall, but we also really like to get rid of all the capsular tissue that's in there.
Super important.
We like to do what we call an en bloc, ENBLOC capsule removal. It really does take all the capsule off of the front and the back part, allowing us to completely remove any sort of capsule tissue that allows all that anatomy to stick back down.
So can I ask a quick question?
Please, of course.
When you're talking about the capsule, that is the body's natural defense mechanism, correct? And that capsule is created when an implant is put in. Can you speak to us a little bit about that?
Yeah, I mean, capsule is an actual scar.
Yes.
And it's worse in patients that have had radiation.
Mm-hmm.
It's worse in patients that have had an infection. In fact, the capsule in someone who's had a bad implant infection can be very similar to the capsule that you find in someone who's had radiation. But I think a big reason to remove the capsule is not as much the aesthetic, but the functional problems.
Mm-hmm.
And I
Form
think,
and function.
yeah, part of what we're dealing with the unfavorable implant reconstruction is the functional limitations. I think what brings patients to us is more things that they can't do.
Mm-hmm.
You know, I can't pick up my child. I can't, exercise like I used to. I have trouble at work because of the discomfort that I'm having because my implant's underneath my muscle, or I've been radiated, or I've had an infection. All those things, I think, ultimately is what we're treating.
Yeah, and I mean, you guys have both talked about the effects of radiation. I know as breast cancer patients, I had radiation myself, and my reconstructive surgeon took the scar tissue out, replaced it with autologous tissue, my tummy tissue. We often say radiation is the gift that keeps on giving.
Mm.
The other question I wanted to ask you guys too, and bring up to you, to the readers, or to the listeners, the viewers. Do you think there are women who just aren't reporting these problems? I mean, you obviously get phone calls. So my concern is, how do we express to the viewers, okay, you've had implant, you're having issues. How do we empower them to be calling? Do you know what I'm saying?
I totally know what you're saying. Even when you look in the literature, our papers on this topic, a lot of times they've sort of decided, they're reporting implant failures, but they fail to capture the unfavorable result. When I say unfavorable, anything that is unfavorable about a reconstruction, implant or tissue, I don't care what it is, if it's asymmetric, if it's uncomfortable, if it's not right, then it's not right.
Yeah.
And I think people should understand that. They should at least understand that there's potential options to potentially make things better, and it's worth looking into it, especially looking into it where, in a practice or going to someone who can offer the full scope of reconstructive options, not just implants or not just tissue, but the full scope of options. And that's, to me, that's the most important thing.
Now, I think autologous tissue plays a huge role here because much like any type of scar contracture, and that's kind of what the capsule is, you have to release the scar and you have to replace it with healthy, soft, supple tissue.
Right.
And the DIEP flap is that. It's healthy, soft, supple tissue that deals with the scar and, of course, provides an aesthetic, and in this case, I think functional outcome. And I agree with Dr. Kocak that the functional piece is very underreported in our literature. And it's not something that people really take into account when we're thinking about what does a reconstruction look like. Well, and sometimes it's not what it looks like, what it feels like.
Yeah, I do. I'm glad you brought that up, because I do think there are patients that are suffering unnecessarily because they don't feel like they have that vocabulary, the empowerment to bring this up or to call people like you to get it, to get it fixed. So guys, thank you so much. Really valuable information. I really appreciate it.
Thank you very much.
Absolutely. So thank you for watching another Deep Sea Foundation YouTube video. Be sure to like the video. We appreciate the thumbs up. Yep. And also, send your comments our way and let us know what other topics we can do for you.
And you can find us at mwbreast.com.
Yes, Midwest Breast in Columbus, Ohio. Thanks, guys.
Thank you.
All right.